Hi, my name is Dr. Maria Lopez. I'm professor and interim chair of medical oncology at the Sidney Kimmel Cancer Center, Jefferson University. And I also am director of the Integrative Oncology program there. At the Society for Integrative Oncology, I co-chair the Health Equity, Inclusion, and Belonging Committee with Dr. Eleanor Walker, and I am a member of the Education Committee, and I am treasurer of the society. Something that's very special and unique about SIO is the fact that patients are part of everything. So, that phrase of nothing about us without us, I think it's really important, and I think it's important that we are on equal footing. So there are many health professionals, we are all on equal footing. There are patients that are part of the team, and we are all on equal footing. I think that's really important. And then that we are trying our best to produce the best science, to share the best science. And from that, I think we're on the verge of a tremendous movement, because we want to get these practices to people. We want to find the best way. So it's very prime for dissemination, for implementation science. We need to do that. And it's very prime for advocacy. We need to be working with the payers so that these services are covered. And not only do they help people feel better, which that by itself is amazing, but they can shorten hospital stays, they can help decrease emergency room visits, all of those areas where by working in partnership, we can make a real difference in patients' lives, and caregivers, and families, and communities. So I think we're in we're at the tipping point of this work. So I became a member of the Society of Integrative Oncology soon after finishing my fellowship. I was kind of looking for a home, and this work, focuses on working with people who have the illness, that have had the diagnosis of cancer, so felt very connected to that. Also the focus on evidence base. And something that I've been really thinking about is, how do we expand or better explore the scientific method so that we can do better science around integrative oncology practices? So feeling that there are kindred spirits here, feeling that there can be that sense of community, really helps me to feel at home, and that this would be the right place to really participate as a professional society. For me personally, I do think of integrative medicine as transformative. In my practice, universally, patients feel better, and I have to say that universally, I feel better. So to be able to say, these are things that I do that I have found are helpful, these are so that it can be very experiential and very bi-directional in that way, is very important. And not that the experiences are the same, because, respecting the autonomy of the other person, but that we can really share and come together, and that I am as grateful as I'm sure that patients say thank you to us all the time, but I definitely feel grateful to be able to practice integrative oncology.